Call to order the City of Franklin Board of Health meeting November 13th, 2023. Dr. Golden is not here, and Dr. Rudlevich is not here. So at this point, we need approval of the minutes from September 11th.
Move to approve the minutes.
Second, any discussion? Hearing none, all in favor of approval of the minutes?
Aye.
Okay, unanimous. There are no citizens for citizen comment period. Is there any unfinished business? Okay, then we'll go right into new business and administrative updates.
All right, for our fall 2023 report, since now we meet on a quarterly basis, we have the months of September and October summarized in front of you. And you'll see some of the events that we had throughout the month of September, one being our blood pressure clinic that our public health nursing staff held. We also had a fall prevention speaker, and we piloted a social connections program with the daycares. So at Jubilee Center, we ran a pilot where we went to a class for 4 weeks in a row to build social connection as part of our maternal child health initiatives. And it went really nicely, and now we're looking to pivot how to tie it even closer into our CHIP priorities. So physical activity, nutrition, social connection is overarching, and then mental health. So that will be most likely rolling out in the beginning of 2024 at Jubilee again, and then looking to branch it out Franklin-wide at daycare centers. So that's two of our public health staff. We also held a suicide prevention training with Volition Franklin. In October, we had the more grandiose event of the Adult Health and Wellness Fair. So that was over at the library, and we saw a couple hundred individuals for their flu shot and then to share information. We had our adult flu clinic, so off-site clinics as well, in addition to the annual flu clinic that we hold over at the library. And we've given about 500 flu vaccines in September and October combined. We had Red Ribbon Week, so that was when Volition Franklin and the Franklin Health Department came together to promote substance misuse prevention. They were at the Common Council meeting, and they encouraged individuals around the city of Franklin to show support for the campaign, to really bring to focus how all community members or all sectors of the community support substance misuse prevention. So there's a summary in your packet as well, but activities from Volition Franklin Youth reached around 600 individuals at Forest Park Middle School and Franklin High School. We held Trick or Treat with the library and other community partners in the library parking lot, and we had over 1,000 people. So that was record breaking for us, even though it was really dreary and rainy. And we had about, 40-ish trunks participate? So 40 different organizations from around the area came out to support that. So that was a nice, safe, family-friendly event that we had going on here. And I'll roll right into inspections as well, just to do the fall report all in one. We had 36 inspections of retail, food, motels, pools, and then 55 transient and mobile inspections. So we had both St. Martin's Fair and then also the Tacos and Tequila event, which really increased the number of inspections that we did as a department. So that was pretty robust for our environmental health staff. Mobile units are still a really increasing trend. So we're seeing that very often, and we're seeing more and more events now kind of in the off season. Typically, this would be a summer event, would have a mobile truck, and now more are looking to come to like winter-themed events, and that's something new-ish for us. So I'm sure we'll stay busy throughout the winter. We have a communicable disease breakdown at the bottom there. In September, we followed up on 82 cases of communicable disease, and in October, 63. And I believe yours are in color. I did not print mine in color, but we still had a COVID-19 response within that. Now the state of Wisconsin has changed the requirements for following up on COVID-19, and we no longer are required to call individuals when they test positive, but we are still a resource for individuals. It would be if there's a pediatric patient or a hospitalization. So that gives a wrap up on what we were seeing in the department throughout the last few months.
At this time, just Dr. Golden, welcome.
Thank you.
Okay. Of those inspections, were there any failures or findings?
Good question. Let me think. I don't know that we did have to turn you know what? I actually don't know if we officially turned one away at St. Martin's Fair, but our sanitarian staff, our environmental health staff work incredibly hard to troubleshoot with the mobile establishment on site when they come. So we hope that everything's perfect. Next step is they can do corrections on site. So get running water, get paper towel, make sure they're using the hand wash sink, make sure they're not storing raw meat on the top shelf, things like that. But if it is beyond that, if practices are not able to be corrected on site, then they need to be sent home. I think we may have had one or two of those.
Okay.
Could you describe just a little bit the social connection program at the daycare?
Yeah, so I talked, let me know what questions you have on it, but our maternal child health initiative is Social Connection for the 2023 calendar year. And one of those things that we are doing is through a partnership with daycares, identifying of how we can really provide opportunities for youth to engage with one another, so not just coexist in the same space, but really be connecting with each other. So
it's about the children connecting, not the parents.
it is in this program itself. We're also doing youth mental health first aid and adult mental health first aid trainings to kind of tackle it on all ages, but we can only do so much, so that's where we're starting a pilot with the daycare. So we did one class at Jubilee. It was a 4-week pilot, and it showed good results, but now we're pivoting it a little bit more to be focused around our CHIP priorities, so physical activity, mental health, nutrition, social connection, and making all the activities that they're doing within those 4 weeks focus on those topics, and then looking of how we can grow that out in 2024.
Then we'll move into Narcan distribution.
Yes, we have our guest speaker here today, Ellen. She's a public health specialist within our department and is also on Volition Franklin. I believe we talked about this very briefly in the past, that we were looking to apply to the Narcan Direct program through the state of Wisconsin. They like ebbs and flows of when they open their program up, but we did apply to be a Narcan distribution site here at the Franklin Health Department, and we were accepted for that, which is exciting. With that, we wrote an internal policy to monitor how we were distributing Narcan and ensure that we were meeting the requirements of the state and had fidelity within our own practices. So Ellen is going to talk to you a little bit more about that.
So again, just a little bit of background. We all saw the opioid toolkit that we put together, I think at the last Board of Health meeting, which was then presented to council to be put on file. So in the process of putting that all together, we did see that there was a bit of a gap for the city of Franklin in regards to access to Narcan. And while it is available over the counter now, it may not be affordable for many people, and there's still some questions about how that rollout of over-the-counter Narcan naloxone is going to look. There is Narcan available pretty close with many of the other health departments, as well as several Narcan harm reduction vending machines popping up in the area. There's one for sure in the former House of Corrections, it was the community reunification site, in their lobby. So that's an area where people could go and access Narcan 24/7. I believe their lobby is open 24/7. But we thought that this, just applying to the Narcan Direct program, would be a good start for Franklin to begin providing Narcan to the health department as well. So just another access point for community members, in addition to, I believe, the fire department rolling out their HOPE kits as well.
Is there a fee?
There is not.
Okay, and what about how do people that know about this?
Well, that's next on our agenda, is to figure out a kind of, I don't want want to say advertising, but what we can do to outreach and awareness for the program. I think we developed a kind of form that people will fill out when they do come into the office, just so we can keep track for data tracking purposes to report back to the state. And I put a few options on there, so our social media, the Franklin website, the city newsletter, and then different outreach through local partners. So Bush and Franklin will help get the message out there, fire, police departments.
High school.
Yeah.
Does anybody have any questions?
I do. I just wonder, like in the whole kits or with the Narcan cans, I heard this special on NPR, this hotline for, don't use alone or something like that, so that people are familiar, they can call this hotline and say, okay, I'm going to use right now, and the person stays with them to make sure that it's OD. And if they don't respond to them, then they call the fire department, and they have them unlock the doors, and I guess it's safe for quite a few lives. So they type on these communities where they just stick a little card in with their kits that they give people, or after people have OD, or they, rescue people, they give them a card for the next time they might use. So I'm just wondering if you've heard of that, if there's a possibility that's, that information is also going out to people here, or...
The Franklin Fire Department is the lead on the Hope Kits. We're a supporting partner. However, I do know information that is going into them, and volunteers are stuffing them tomorrow. And that, correct me if I'm wrong, but that is included as one of the resources.
It is, okay.
Okay, if there's no other administrative updates, we'll go to clinical service updates and 23 immunization clinics.
Yes, so touching on that already in the fall report, but 500 flu vaccines were already given in September and October. So
How many did you have?
500.
How many did you receive?
Oh, good question. I actually don't know off the top of my head how many we received.
I think flu we've been fine with. We haven't had any shortages there. It's COVID
Okay.
that we're struggling in many areas.
That's a new variant of COVID.
That's a good lead-in to our next agenda item, if you don't mind. If we go ahead to the COVID-19 distribution kits.
Yes.
So we do still have that. So if you recall, we were selected as a pilot site to host those distribution kits at a local health department. We have been following our policy still of giving individuals, we have not had any issues with individuals wanting more than this, but one kit per person per month. We'll see where we take it after December 31st as we approach the expiration date within a few more months to increase that number. But in July, we gave out 18 kits, August 34, September 16, and then October and November, both just 2 kits. So looking to do another push to get that information out there ahead of the winter season. Yeah.
So what's in the kit?
It has 2 Narcan test kits, so you can test.
Right.
Sorry.
Yeah.
COVID test kits, so you can test
And that, we just throw it in.
Yeah.
Yeah.
You never know.
Both will be a counter service, but no, our COVID test kits have 2 tests in each kit.
Okay.
How were you guys though for your COVID vaccine?
We're working on that right now.
Yeah.
So figuring out how we're going to roll that out, what that's going to look like with the BFA, BFC program. But it all kind of hinges on the state and our ordering abilities through that.
Yeah. Or very, yeah.
If you're having complications in
I'm
ordering.
just telling people, go to Walgreens. For some reason, they never have a shortage. So,
Which on one hand is good,
yeah.
well, but then there's also barriers to that,
Right.
so.
Right. Yeah, when the health systems can't get them in.
Yeah.
Can you tell me, I heard, someone told me that with the current strain, the nasal testing doesn't give you the information because you have to do like throat
We're getting-
swabs.
We're getting positives. Yeah. But now we're like having people do them themselves, so it's as good as a person can test themselves.
Yeah.
But there's no change in terms of the virus and basically that it's picked up by the virus,
I think when you can do a nasal and a pharyngeal, it's always better, but for the home kits, I think we're just happy to have people test.
Oh, yes, Mike.
When you have a COVID test, like when the COVID came through, I had like a series of 3 tests, maybe 4, I don't know. And I'm sure there's been some iterations of it since then. Can you just jump in to wherever it is, or do you have to try to play catch up with what was out there, or?
For vaccines?
Yeah.
I think if you went right now, you would get the new variant vaccine.
So whatever I missed. If I missed 1 or 2 of the years.
Or you got COVID and it gets off of you, yeah.
So far, I'm okay.
Yeah, no, you just get what our current,
Okay, so
Right.
no sense going back to try to recover.
No.
If it's current, it's what we're doing now, okay.
Okay, we'll move right into communicable diseases report.
I'm gonna have to figure out how to lay this out nicer on the agenda, but given that we give the health report at the beginning, it kind of covers all of those things. So the breakdown,
Right.
pie chart is on the bottom of that with the number of STDs, the ratio of STDs we followed up on, and then COVID-19. But then, just to reiterate, September 82 CD follow-ups, and then October 63, which is pretty high numbers. So our communicable disease staff give each of those individuals a call and then touch base with them, give proper education, and then help determine next steps if needed.
You see elevation in any disease?
No, we have not seen anything out of the norm. We have our public health nurse staff bring that to staff meetings bi-weekly if they see anything kind of unique or unusual, but no.
Questions on clinic services? Now we'll go right into health department, problematic updates.
We have a lot of things coming in the future. 2 exciting things is some interns that we have coming. So we have a Medical College of Wisconsin Masters of Public Health student who will be doing an 80-hour internship with us in the January through May semester. And then we have a community health education undergrad student from UW La Crosse doing 560 hours with us for her internship. Yeah. So one of our public health staff is going to be working closely with our MCW intern, and they'll be doing some work with environmental health in that program and doing a project brief. They will be doing a park audit. So one of our initiatives in the health department right now is to determine if parks are currently accessible to anyone who may want to be using them in Franklin, and staff have compiled a audit form which we're using with the help of volunteers, having that completed, and then we'll be presenting those findings to the Parks Commission. And then some work with Volition Franklin. And then the other community health education intern, Ellen, talked to today. So do you want to talk a little bit about what she's going to be working on?
Yeah, so she is really interested, doesn't have any particular passionate area of public health, so she really wanted to be placed with the health department so she could get a little bit of everything. She is going to be working a lot with Volition Franklin to do some data collection and kind of look into what data might be missing to get a better picture of substance misuse or youth substance misuse prevention in the city. She'll be supporting the community health improvement plan work groups. Probably some event support for the upcoming spring run, the Light Unite Red campaigns that typically happen in March, as well as maybe some programming for Alcohol Awareness Month in April with Volition Franklin. And then doing some shadowing with all of our staff. She's also very interested in harm reduction, so I think that that'll be perfect now that we're kind of rolling out the Narcan Direct program services.
We also have Healthy Holidays coming up, so we only have that in draft form right now, but this is a program that we've done every year for the past few years, and it's popping up education tables at locations throughout the city so that it's not a barrier to get education depending on where you go. So in places people frequent, like the grocery store or the library or a coffee shop, just to get more information out there. So we're looking to do a car seat safety event, some education on substance misuse prevention, a table on mental health, holiday food safety, holiday preparedness, and those will be throughout the month, well, late November and then throughout the month of December. And we're always looking for volunteers, so if anyone's passionate about sharing education, that's an opportunity. But we will have health department staffed at these tables to provide that education. I mentioned it a bit, but we'll be doing that park audit. So ideally, this would have been happening in a much warmer time. But it is, we'll see if it goes into the spring or not. But it is to look at all of the City of Franklin parks, its features, lighting, what material it's made out of, what parking's like, if you can just enter onto it from street level and things like that to see the accessibility nature of it, and then compiling that into a report for the Parks Commission. We also applied for and were awarded a grant through the Wisconsin Cancer Collaborative to work to prevent cancer within the city of Franklin. And one of those initiatives, Volition Youth are very passionate about healthy lungs at play, so how to prevent secondhand smoke exposure at parks. They've been meeting with the American Lung Association, FACT, so the Wisconsin coalition that does youth smoking prevention. We have a youth advocate on the leadership team that's been doing a lot of work with her peers, and they're looking to how to present this to the parks to try to get it passed, to have some kind of rule established for City of Franklin parks to be smoke-free, so that individuals who are using the park facilities won't have that secondhand smoke exposure. So we'll see if that happens. We're looking to take that possibly in December, and there's also funding available through that grant award to do signage. So if the Parks Commission is looking to update rule signage with the new rule on it, that could be an opportunity. We also have a Mind Over Matter Healthy Bowels, Healthy Bladder program that started a couple weeks ago. So that is always a full program, and that is in session. So the health department leads that at City Hall. And I believe that's all for updates.
Anything with the senior citizens?
That Mind Over Matter.
Okay.
We have a standing invitation to go to the Root River Senior Lunch program that meets the first Wednesday of every month. So we are looking to really capitalize on that and be able to share more education and materials going to that. The Adult Health and Wellness Fair was fabulous. So we had really positive feedback from that and a really robust number of volunteers. So Lion Club, Lionesses really turned out for volunteers. It was really a consistent, steady stream. So sometimes we have like a big clog up, people like coming at variable times, maybe not at their appointment. And it was the first year that it actually was like wonderful with the amount of flow. So that was a good improvement. We did the drug collection, so expired or unused medication in the lobby there with Volition Franklin and the police department, which was also nice.
Amy,
Oh yeah, and one of our public health nurses was trained as a facilitator for Stepping On. So she did that at the beginning of November. So now we'll have 2 individuals who are trained to do the Stepping On program. And it's always in high demand, so fall prevention practices within Franklin.
Okay, great. And we spoke a little bit on Volition Franklin, but I think there's more on the Blue Ribbon.
There is. So Volition Franklin had applied to be a Blue Ribbon coalition and was recognized as a Blue Ribbon recipient. So they're, now I've said it so many times and I can't remember, 1 of 12 or 1 of 15 in the nation. So recognized for the coalition efforts. And we're invited to the Office of National Drug Control Policy in DC. So we had 2 representatives go there 2 weeks ago now. Alan was one of them, and then Megan Conway, our Drug Free Community Coalition Coordinator, was the other. And one of our youth advocates, Syra, who's been at some of the council meetings, also went. And she was selected for the youth panel. So we nominated her, and she was selected, which is amazing. She did a really fabulous job. So that is a fun spotlight on the coalition for all the great work they've done in substance use prevention. And from that, we had submitted a presentation, and it was accepted for the community, well, CADCA changed their name, so now it's just CADCA. But they previously were the Community Anti-Drug Coalitions of America. They have a conference every February where coalitions come, and we'll be presenting at that as well. So exciting stuff with Volition Franklin.
So you want to fill the wall here?
I know, we should do that.
Just keep
Little
going.
gallery or something. They've really moved the needle on the rates of underage drinking, and really just phenomenal. We have so many different sectors at the table. The school district is supportive of the program. Kids have been really active, so it's really a youth voice, which is so neat to have, and so fun to see so many kids passionate about prevention among their peers.
Okay, anything else in our volition? And we'll move into environmental health updates and the pool codes and fees.
All right, so the state, well, I'll just read this here. So state legislator passed an update for DACF rule, and it has included a pool fee schedule update. So that is through the DACF program, and they've updated their schedule, and now we've updated ours. So this is where we currently are with our current pool fees, and now where we're looking to move to. So essentially, they've created a new assessment tool, which I've included here within this packet, and it now puts pools in different types based on their risk and complexity of their operation. So it's a grading scale, and it depends on what features they have and what kind of system they have in place. But below is our new proposed fee schedule that we'll be taking to council. And I wanted to bring it before this group for general awareness. And it's been through a lot of work looking at our old fees that we have not changed in many years, looking at the new structure with the DACF schedule and what they're needing, and this is where we've landed. So it's pretty comparable to other municipalities in the area. Some are lower, some a bit higher, but it is what best suits the city of Franklin.
How many public pools are there in Franklin?
It's like 12.
Wow.
11.
Public pool?
Oh, it's like swimming pools at schools, yeah,
Oh,
like an apartment
okay.
complex, so that public are swimming in, but not like
Would that include even like tuck away a private club?
yes.
Okay. And then features just means different depths. When it says complex, moderate with features.
No, so a feature, okay, let's see. Feature means a pool with a depth greater than 16 feet, a pool with a surface area greater than 20,000 square feet, or a physical object permanently installed in a pool that's intended for recreation use, including slide, water slide, pad walk, basketball hoop, diving board, etc. There's a lot of different things on there. Yeah, well, you never know where we're headed, so it's good to have
Where's
this
that
all
pool?
accounted for. And so you'll see here it builds upon itself, and then the inspection fees, or the one-time pre-inspection.
Is that license fee annual then?
It is.
Okay. Any questions? Any other information you?
I think we should talk about our 2024 meeting
Absolutely.
schedule, but other than that, I don't have any.
Okay.
I have a couple things. One, I heard from, I was active with the Lions Club, and they really want to contribute to upgrade the health department's, is it vision screening equipment? So I think that they tried to contact someone, but haven't heard back. They were going to come tonight and speak during community comment period, public comment period, but they didn't make it. So who would be the best person? for
Yeah,
that?
I'll follow up with them. Megan and Jamie have been working on that, and I know they've been in communication with the Lions Club, so.
Yeah, as of yesterday, or maybe it was today, they hadn't heard anything.
Okay, that sounds good.
And I'm just also wondering, is there a timeline for to continue with the improvement plan?
There is. So the next meeting will be set in January.
Okay,
So the goal will be to go to quarterly meetings,
okay.
and then intermittent work in between if the work groups are looking to do that.
Okay.
the preference would be the beginning of the quarter, because if we don't make it the end of the quarter, then
Oh.
we miss a quarter.
For Board of Health,
Right,
okay.
so,
Which would bring us to January.
right. What day, do you have a calendar?
Yeah, I do have a calendar. All right, let's see here. So the second Monday would be the 8th.
And we're committed to staying on the second Mondays, is that important?
At this time,
So then that would bring us to April, also the 8th. And then that would bring us to July. Do you usually meet in July?
No, we would have to do that one
So should we do it in August?
August, yeah. Well, actually, no, we always took July and August off, but if we're taking June off, we could do August.
Preference from the group?
So we're doing January, April.
Looks
The
like
8th of January,
August
the 8th of
12th.
April, then August, what?
12th.
12th. And then October,
14th.
okay. If that's an issue, if anybody finds out, let us know. Maybe we can change things around, we have a little flexibility now.
I'll send an email to the group as well for the members that are not here on that as a reminder.
And all would start at 7 o'clock. We're keeping the same time. If there's no other discussion, I need a motion for adjournment.
So moved. Second.
Okay. No discussion, all in favor?
Aye.
We are adjourned. I wish everybody happy holidays.